Today I'm going to introduce hantavirus. As a disease that first recognized in 1997, hantavirus most likely brought over from Europe, the source of first infection transmitted from primary reservoir. There are 4 different mouse: white-footed mouse, rice rat, deer mouse, and cotton reed. Humans, once a human got this disease, they are mostly like dead-end host. But fortunately, the disease cannot transmit virus to other humans. There are 2 weeks incubation period before symptoms are present. It's similar like influenza. First, you have 3 to 5 days period before you find out you got this disease, and you realize that you have stomach pain, fever, headache, diarrhea, and even vision impairments. Eventually, this progresses to pulmonary edema, the fluid in lungs, without treatment. And the result of the infection can also progress to thinning of blood and vascular walls that causes bleeding and kidney failure. Once humans have this infection, the fatality is 35% to 50%. You can find the place where hantavirus in the world, like most southern United States and Mexico, where rats live. Most cases have been reported in North United States, where deer mice can be found. On January 2017, we have the data. You can see most people that have this infection are white male, and 96% of cases in states in west of the Mississippi River. Here are the maps of where deer, mouse, and cotton reed live in North America. Those exposed to mice carrying hantavirus, places like farms, area where mouse population high, and most infection require direct contact with infected mouse dropping. Few cases of human-to-human transmission. That's fortunately a good thing. About the societal risk, the research for a vaccine for those who are susceptible to infection that are low due to inability to transmit human to human, and the healthcare cost of treatment. The most important thing is how to solve hantavirus. When going to place with high mouse population, you need to take extra precaution. You can wear a mask to avoid inhaling infection phases in the air, and you need to wash hands and clothing thoroughly. You need to avoid area with high mouse population and do things to avoid mice attraction. For example, you can leave food out from your house in deserted homes and buildings. About the treatment is about the rodent control. You can clean up the area that attract mouse, food abandoned buildings, inactivated vaccines for those endemic areas. First one improved in 1997 with few side effects. A live virus vaccine does not exist yet. The future of hantavirus in public health. Strong evidence that reactive T cells are sufficient defense against hantavirus. Important to synthesize vaccines that have high cross-reactivity as it spreads to other hosts and mutates. And vaccines effective with minimum side effect and available to those who live in endemic area. My own opinion toward the situation is hopeful that effective strategies of pest management will arise as well as a vaccine that will have cross-reactivity. I trust early detection of infection will improve mortality in patients and reduce incidence of hantavirus pulmonary syndrome. Thank you.